Hello, everyone. I'm just monitoring the wait room for a couple of minutes to let in anyone else who's still requesting to join. In the meantime, if our wonderful scholarship recipients could please turn on their cameras so that all of our audience can see you all today on our event. Thank you to all of our OPO partners who are on the call today, the wonderful organ procurement organizations that SOTA partners with and that support us in this work, as well as our industry partners and our scholarship selection committee members. It's so wonderful to have so many people here today to celebrate our scholarship recipients. Just giving it a couple more seconds to see if there's anyone else coming into the wait room before we get started. Alrighty, I think we will get going and just keep an eye on the wait room in case there's anybody else. Thank you all so much for being here today, to all of our scholarship recipients for making time out of their busy schedules, and all of our OPO partners and industry partners, as I mentioned. I just want to make sure everyone can see the screen that I have shared. Can I get a thumbs up? Okay, I see some nods. Thank you very much. Again, this event is to celebrate the hard work of our 2025 scholarship recipients. And the agenda is as follows. We'll start with a few introductions along with a word from our sponsors, Daniel Gives Back and Second Chance Fundraising. And from there, we'll move on into the scholarship recipient presentations, where each of our recipients will share more about the on-campus advocacy events they each hosted and the impact that they experienced and how they felt it went reaching their peers. So for anyone who may be newer to SOTA, this is our two full-time staff, myself and Nicole Nidia, who's our executive director. We're a small but mighty team here that keeps SOTA going. And it's been really wonderful to get to work one-on-one with all of our wonderful recipients this year. I'm responsible for managing our student relationships and facilitating our OPO partnerships. And Nicole does the fundraising for SOTA, the more national partnership side of things. And without further ado, there were 3 scholarships that SOTA offered in 2025. Each spring is when we open up our scholarship applications. So pretty soon here in just a couple months, we'll have our next round going. And in 2025, we offered the Daniel Gives Back Scholarship, the HBCU Donation Advocacy Scholarship, and the Student Advocacy Scholarship. And for each of these scholarships, we had a scholarship selection committee who read through every applicant and voted on their top candidates to be the recipients. And it's really thanks to that hard work of those selection committees and the members on the call today who selected all of these wonderful recipients we're joined by. And these were the largest group of applicants we'd seen any year. It had grown quite a bit from 2024 to 2025. So these students really are top candidates. They really explained themselves very well in their applications and had a lot of potential going into hosting their events. So we're looking forward to all of you getting to meet them today. And speaking of our wonderful scholarship sponsors, I see that Benny is on the call today. I would love, Benny, if you're able to unmute and share a little bit more about Daniel Gives Back and your inaugural scholarship with us all. Able to unmute?
Yes, can you hear me?
Yes.
Yes, hi everybody, and congratulations, of course, to all the scholarship recipients here. It's really a testament to your achievements and plans going forward in this field. So we are, I guess it's like probably 3 years that we're affiliated with SOTA. We are a family of an organ donor our son Daniel, and hence the Daniel Gives Back organization. So our personal angle, Daniel died in an accident, and his organs, 4 organs, was able to donate basically 4 organs to 4 recipients. And through this interaction and through working with Versity, which is the organization in Wisconsin, Illinois, and a few other nearby states, we made the contact with SODA. And I guess this year we were fortunate and very proud to be able to sponsor one of the scholarships. Another angle of our personal family. So Daniel's sister Lola, she had a SODA chapter in her high school that she graduated a year and a half ago, and now she's in the process of opening a chapter in her college in Northwestern University. So we see our cooperation going forward for many more productive years for everybody, and doing good for our cause. We have a little guy here too, but he's a little bit bored.
Oh my
Yeah.
God.
Hey, you want to say hi, Nate? Hi. Okay. Yeah, this is little Nate.
So adorable. Thank you, Benny, for
Yeah.
sharing with us
Yes.
about Daniel's
Thank you.
back. It's
And
been
I'll mute now just to prevent the background noises from coming in. But if needed, I'll unmute again.
Sounds good. Thank you. It's really been so wonderful to work with your whole family and Lola, as you mentioned, being involved with SODA. So it's very special, and to see Nate here is adorable. Thank you for showing him to all of us. And our other wonderful and longtime sponsor who's been with us since nearly the very beginning of these scholarships is Second Chance Fundraising. And I see Craig is on the call as well. So Craig, if you're able to unmute, we would love for you to share more with the audience about Second Chance Fundraising.
There we go. Sorry about that. Hi, everybody. I'm Craig Smith. I'm the founder and executive director of Second Chance Fundraising. A little bit of background is that 10 years ago, I received a life-saving heart transplant after going into heart failure due to a virus. And so after my transplant, my best friend and I, we started Second Chance Fundraising as a way to give back and to raise awareness in the community. Over the years, we've done a lot of different fundraising events and working with our OPO and other organizations here in the Western Pennsylvania region. And, after we started having some more responsibilities in life that really kind of inhibited us from doing as much of the boots on the ground advocacy as we used to and as much as we'd like, we started looking for other avenues to be able to make a difference with the fundraising dollars that we were bringing in. So that's why we started working with SODA, so that we can help support college students in a small way so that they can do advocacy work on their campus. I think it's very important for people in the community to hear this message and to hear about the importance from organ donation from their peers and from people who they can have a very personal connection with. So we love doing the scholarships, and we love the impact that it has made on campuses across the country. So that's a little bit about us. And, I'll echo Benny's statement and just saying congratulations to all the winners this year. And I'm looking forward to hearing this evening about all the great work you did on your campuses.
Thank you, Craig. It's been such a pleasure to work with you all of these years. I believe we're going into our 4th year of SODA scholarships. So it's very special to see how much it's grown and how many applicants we've reached, and having such longtime supportive partners who look to students as the future of donation advocacy is very supportive and inspiring. So thank you both for sharing more about your organizations, and to all of our recipients. I hope that you feel connected to your sponsors and the stories that they have to share with you. And so, as our recipients are well aware, part of their scholarship agreement was to host an advocacy event that focused on educating their peers about organ, eye, and tissue donation and registering their peers as organ, eye, and tissue donors. And here at SODA, we really believe those are the superpowers of our students. And as Craig mentioned, that peer-to-peer advocacy is so special, being able to meet your friends, your classmates, your wider student body in a setting that's familiar, where you can really connect and have conversations that might feel intimidating but can be relatable when you're the ones leading them is very empowering. And I'm looking forward for you all being able to share the ways in which you took on this leadership role. And that takes us right into it with first up, our Daniel Gives Back Scholarship recipient was, this is our first year of our Daniel Gives Back Scholarship. It went to Amelia, who I will now invite to unmute and share more about her scholarship event.
Yes, hello everyone. My name is Amelia Rawnewski. I had a deceased donor kidney transplant 17 and a half years ago, and I started our SOTA chapter at American University. And as part of this scholarship event, I hosted an event called Soda with Soda. And so the idea was we had a bunch of soda and different fun drinks, and we taped these organ donation facts on it to encourage AU students to just honestly start a conversation about organ donation. So, yes, we had all of these drinks. We printed out a bunch of labels and we put different facts on it, like one organ donor can save up to 8 lives, and this many people are waiting for an organ transplant. And it honestly, it was a great success. We were able to connect with a lot of students. We got to start great conversations just with the little facts we had on them, and it was a great event overall. Um, my advocacy event happened, like it says here, October 16th of 2025. My event involved we were tabling in like our student center, and we were handing out sodas to people who were interested in talking about organ donation. My favorite part of the event was that honestly it was just a different modality to connect with students. A lot of times when we do tabling events, we do um we do donuts, we do cookies, and this was just a really fun event to be able to connect with students, have them pick their favorite drink, and of course learn about something that is so close to my heart, which is organ donation. And we educated over 70 people through the event. I can't remember exactly how many drinks we had. I believe it was 72. And we registered 2 people as organ donors, which was great. And something new that I learned is I just learned about how truly important it is to connect with students. I really think so many people came up to me during this event and they're like, I registered as an organ donor, but I haven't really thought about it since then. And I have this question that I've never really been able to ask anyone. So it was really great just being a presence on campus, being a resource for students to come and ask questions to. And yeah, I got to sit with my friend here, Emily and I, and it was a great event. So thank you so much to Daniel Gives Back. And yes, thank you so much.
Thank you, Amelia, for sharing more with us. I love that you taped the facts onto the soda cans. I think that's super creative because they can take that with them along with the soda. And we know, of course, incentives of food and drink are really popular, and it's such a good conversation starter. So to hear that people were comfortable to ask you questions and to share more about their decision to be registered as donors is really inspiring. And all of these photos that you included are wonderful. And to know that your SOTA chapter is still on campus, actively advocating, and this is just a small piece of what you've all achieved this semester is really wonderful to hear. So thank you so much for sharing with us. And yeah, of course, we will now transition to our HBCU Donation Advocacy Scholarship recipients. Our role in closing the health equity gap is very important to SOTA, and in addition to our HBCU scholarships, we also provide an HBCU internship, which I will share more about towards the end of this call for any students who might be interested in being involved. We also work with industry partners to regularly review and update our chapter resources to ensure that they're inclusive. That includes groups like AMAT, the Association for the Association for Multicultural Affairs and Transplantation, and NMAG, the National Multicultural Action Group, lots of acronyms. And We also partner with our OPOs and other organizations to identify leaders on HBCU campuses and support them in bringing donation advocacy to their peers and to communities that need it now more than ever. So our first recipient, our first recipient was unable to join us today, so I will go back to share her video with everyone. If there are any audio issues, feel free to let me know in the chat.
My name is Samara Bell. I'm a freshman health science major at Howard University, and I am one of SOTA's HBCU donor scholars. And today I'm going to talk about the event I held. It was a discussion and letter focused event that allowed people to build their own opinions about organ donation and really just brought everybody together to have a really good in-depth conversation. So onto my slides. I'm really passionate about this work because I've seen how much confusion, fear, and misinformation exist around organ donation, especially in communities of color. As a young Black woman interested in medicine, I've grown up hearing hesitation and mistrust around healthcare systems, and a lot of that comes from very real history. I believe people deserve honest information and the space to make informed choices without pressure. That's what pulled me into this advocacy work. My advocacy event took place on November 14th, 2025, and it was designed to feel very relaxed and approachable. Instead of a formal presentation, it was more about conversation and dialogue between peers. The event involved setting up a space where students could come by, ask questions, and just talk. I shared basic information about what organ, eye, and tissue donation actually means, cleared up common myths, and talked through concerns people might have had. A big focus was letting people know that donation is a personal choice and that learning comes from committing. My favorite part of the event was honestly the conversations themselves. I had multiple moments where people said things like, I never knew that, or no one ever explained it this way before, especially with women of color. There were really meaningful conversations about trust, representation, and feeling seen in healthcare, which is all great things to be able to discuss on a basis of this way. Being able to listen and meet people where they were meant a lot to me. Through this event, I educated about 10 to 15 people, and I'm unsure of how many chose to register as organ donors, but even for those who didn't register, many told me they plan to think more deeply about it or talk to their families, which I considered a win. One of the biggest things I learned from working with SOTA National and my OPO is that advocacy isn't about convincing people, it's about building trust. I learned how powerful peer-to-peer education can be and how important it is to approach this work with empathy, cultural awareness, and patience. Overall, this experience really confirmed for me that this is the kind of work I want to keep doing. It strengthened my interest in medicine and reminded me that the real impact often starts with one honest conversation. Thank you.
And I really love that in Samira's presentation, she hones in on the importance of building trust and that being such a pivotal stepping stone with women of color, particularly that she was working with, and how just starting the conversation, starting to answer the questions that they may have is such an important step in the process to truly registering people as donors and changing that stigma. So although she couldn't be here today, I'm really grateful for her for sharing this slide and all of these wonderful photos. And I will now turn it over to Kennedy.
Hey everyone, my name is Kennedy Bozeman. I'm a junior biology student from Atlanta, Georgia, and I currently attend North Carolina A&T State University. For my tabling, I decided to set up in the Student Center. I bought around 5 boxes of donuts, and of course, that brings the attention. Everyone wants to know, why does she have all these donuts? What's going on? So once I brought them out, I kind of got people first interested in what I was saying. I definitely wanted to explain what SOTA was to everyone. I wanted them to be educated on just it as not even just as a scholarship that they could receive themselves, but as a bigger organization and really just spread the importance of SOTA. I definitely had to have a lot of discussions because, like Samira said in the beginning, there are a lot of myths that a lot of Black people think when it comes to donation, organ donation. There's just a lot of distrust with healthcare in general. So I think that's like a big part of me, a big part of like the public health advocacy that I love specifically is breaking those myths because at the end of the day, there are people scared to go to the doctor just simply because they hear things about like Henrietta Lacks and the Tuskegee men. Like there's just so many things in the past that has broken the trust of so many people. So people hear organ donation, they're like, no, we're not going to do it. So I think that was like the first layer, getting them to understand like, hey, you see me, I'm Black as well. I am somebody who is deeply passionate about this, and I genuinely think this is why you should listen and hear me out for what I am saying. Because honestly, there are a lot of people out there, and a lot of patients aren't able to get their matches because a lot of African American people are scared to donate. So that's also like a large problem in our community. So I think that was like the number one thing, was getting to talk to the people in my community. I do a lot of things on campus, so people see my face often. And so I think initially, again, the donuts were a big help for drawing attention, but just getting involved with people on campus, it was very important for that. I love just talking to people. I think that it wasn't too many people that signed up, but I definitely think it did get a lot of gears spinning as to, okay, maybe this is something to look into, or this is something I should tell my parents about, because you can never know how your impact can affect the next person. So I did this at the end of the semester, and it did help that the Girl Scout troop that we have along campus was having another event. So we kind of did like a joint tabling thing to where theirs was on the table next to ours. And then that again brought a lot of traction to us. I think definitely my favorite part was the seeing the real conversations in real time. I kind of brought up and looked up some facts that people, just some myths. Just honestly, that was like the biggest goal, was squashing the myths. And I think seeing people's reactions in real time was my favorite part, because it's like, I didn't think of it like that. I didn't know that. So I think that definitely was my favorite part, and I definitely just if I couldn't get people registered, guiding people to the SOTA's website at least, just so they could understand truly what you guys' organization does, like, and that it is important for us to sit there, get registered, and yeah, it was very fun. So thank you.
Yeah, thank you so much for sharing. And I love that you mentioned starting those conversations and really reminding people to take the information they learn to their parents, because it really is the decision of family members when it comes time to consider the prospect of being an organ donor. So having those conversations are so important to make sure that the people in your lives are aware of your decision. And of course, the myths that you mentioned and the many medical studies, I think your public health background sounds like it really came in handy to have educational conversations. I remember learning some of the same things when I was a public health major as well. And strategically partnering closely with the Girl Scouts is super smart. I just bought Girl Scout cookies the other week, so I'm sure that would have made me stop and want to ask a few questions as well. So I think that this is a really great example of a strategic event where you really utilize your education and your leadership skills. And thank you so much for sharing so thoroughly with our audience.
Thank you for having me.
And lastly, for our HBCU scholarship recipients, we have Branaya on the call. Whenever you're ready to unmute and share more with us, we are ready for you.
Hi everyone, I'm Bernard McLean. I'm a sophomore neuroscience major here at Xavier University of Louisiana. And on November 11, I did the Gift of Life, my organ donation awareness event, and I partnered with the National Society of Black Women in Medicine chapter on my campus, and also had a lot of help from Miss Cheryl, who's with LOPA, the Louisiana's uh, organization for organ donation. So how my event went, I did introductions. I forgot to say why I'm passionate about organ donations. So I'm passionate about organ donation mainly because of my mother, who is has a severe kidney condition, and she's actually on a transplant wait list at the moment. But growing up, when COVID-19 knocked her already existing condition to severe. I had to watch her struggle regaining her life back, not being in the workforce, but having that disability, being tired all the time. So it really impacted me throughout high school, and it inspired me to become a donation organ donator. And then with this scholarship, it helped me want to bring it out to the students here at Xavier. So with my event, I first did introductions. I just asked the question, what brought everyone to this event? Like, what is their connection with organ donation, like with family, just friends, or just just anything you're interested if you're wanting to be organ donator, donation doctor, or anything that matter. And then another, which was my really special part of the event, was sharing my mom's video. I asked my mom to make a little 3-minute video talking about her story, how it was with her condition, and how she hopes to see other Black women and men advocate for organ donation and registering for it. And then I also did a little educational segment where I did facts and what I did myths versus facts and just like a little game with them. And then lastly was my little Jeopardy game, which was also a favorite part of the event. So with everything that I taught them for that day, I did like a little Jeopardy game. We did partners, so it's a really good way to connect with each other. And I had each group, if they were to win, they get little gift cards, like Sephora gift cards. So it was super cute. And it was super fun, a lot of challenging, and it came with like a lot of questions too. So it was super fun to go with that. And then for how many people I educated was about 11 people, and I still have the cards. So whenever I have the chance to, I do give them out. And about three told me they registered, so that was true. And let's see, something I learned from working with Soda National is the work that their chapters are doing. I actually had some students come up to me wanting to engage in doing a chapter. So we've been asking other students, trying to find advisor for a club because for our school. So that's been nice to work behind the scenes for that. And additionally, with my specific field with Miss Cheryl, I learned a lot about the work she does outside for the New Orleans community. She goes through a lot of college events and does a lot of community outreach events. So even the students that I was with there, they asked her about her experience. She was also there with me. She's in I can't point it, but she's in the third picture all the way to the right. And
Thank you so much for sharing. There are so many elements to your event that sound like altogether create some really great impacts. And I think it's wonderful that 3 out of 11 students were able to register following your education and with Miss Cheryl. And I love that you mentioned you were able to incorporate your mom's story so centrally into your event because storytelling really has so much power in impacting people and leaving them with feelings that they can attribute to next time they think of organ donation or when the conversation comes up, to be able to hear and recall your event and the stories that were shared is really special and impactful. And for Lopa and Miss Cheryl to have been so closely involved is a really beautiful example of how students can work so closely with their OPOs and receive support with their events and also be connected to their community. And it would be really exciting to get to support a chapter at Xavier. I went to Tulane, so our campuses are close. For anyone who doesn't know, I used to drive by Xavier all the time. So next time I'm there, maybe I could pop by for a visit. Hopefully it comes together.
Thank you so much.
Yes, and thank you to all of our HBCU scholarship recipients. You all did such a wonderful job. We know that there are some very difficult questions and conversations that surround organ, eye, and tissue donation, especially in Black communities. So to be leaders and champions of those conversations is so inspiring. And with that, we will move into our student advocacy scholarship recipients. We will start off with Mary whenever you're ready to unmute and tell us a little bit more about your advocacy event.
Hi, I'm Mary Christos and I attend the University of Illinois Urbana-Champaign. I'm passionate about organ, eye, and tissue donation because I myself received a heart transplant when I was 3 years old. And it's always just kind of been like a norm to me since I got it so young. But in recent years, I have had some side things happen, such as PTLD, which is a side effect that can happen from organ donation. My advocacy event happened early in October. And an assistant director of research instrumentation at U of I actually reached out to us when he heard that we had restarted the chapter and expressed interest as he had recently had a lung transplant. So he spoke at our advocacy event to share his story, his medications, how the transplant process works, and just like where he is overall now. And then the second half of the event, we also had a craft where members got to write their like why or their purpose on a pumpkin, hence like the fall, like Halloween time, and decorate it, which is why we called it Pumpkins and Purpose. My favorite part of the event was listening to Dr. Cypersmith speak because I found it really interesting since I was so young, I don't remember like a lot. So hearing his story was really moving and inspirational, and also being able to relate to some of the information he was sharing was really cool. Like on one slide, he shared all of like the medications he takes, and it was really cool seeing like a lot of the overlap and how it's so universal for all transplant patients. And since we're a brand new club on campus, we tend to see about like 9 to 12 members come to the events. We're kind of trying to work on engagement. So at this event, we educated about 9 members about organ donation. Thank you.
Thank you. That's really incredible that you got to connect with your guest speaker and could really relate to the material that he shared. I know we hear from chapter members that it can be really wild when you feel like you have this unique experience and then you come across someone who can resonate with you so deeply and really share in what that experience means. So I'm really grateful that you got to bring that to your chapter and to have your members there to share in that with you. And I love that you incorporated pumpkins. I love fall, my favorite season. So I imagine this was a really festive way to pair a conversation and some education that's not always the easiest to work through with a really fun, creative, and lighthearted activity. So thank you so much for sharing more with us, Mary. And I will now open it up to Addison. Whenever you're ready, you can go ahead and unmute.
Hello, everyone. My name is Addie Jones. Addison Jones, just call me whatever. I don't care. I am unfortunately recovering from the flu, so I do apologize if I cough at any point. It's actually really annoying. I wanted to start off before I talked about anything to thank the SOTA organization for this opportunity. It was a really great experience, and I really enjoyed advocating for something that I'm passionate about, and your support made that achievable. So thank you. I am passionate about organ donating because almost 2 years ago, my grandfather passed away very suddenly, and he donated his organs to various people. I think kidney, his lungs, lots of organs. And I believe it is one of the most selfless ways someone can save lives. And learning about how many people are waiting for transplants really opened up my eyes to how urgent this issue is. Um, and my grandpa dying actually inspired other people of my family to register as organ donors, so that was super cool. Um, my event happened December 15th in my college's student union. I set up a table with Dunkin' Donuts, as you can see in the picture, and I had everything from the soda kit to kind of go along with that and help advocate for this issue. Um, Due to this being close to finals week, there weren't as many people as I hoped, but I educated about, I would say, 30 people. And then I think out of all those people, about like 2 people registered. So that was a super good win for me. I'll take it. I was happy with those results. Um, so even though the attendance was smaller than I anticipated, the experience of connecting with my community and sharing information about organ donation was super meaningful to me, especially since I'm new to the area. Being able to connect with people was super cool. Through SOTA, I learned how education and conversation are important when it comes to organ donation. Many people already had misconceptions before coming up to my table. I learned how to explain the process in a way that made them feel comfortable, informed, and building trust with them. I also learned how to organize an advocacy event and stepping into a leadership role. And as a shy person, this allowed me to use my voice and come out of my shell. And I met a lot of new people going been to it, so that was super nice too. And this experience also showed me that even small events can make a difference. It strengthened my passion for organ donating and encouraged me to continue advocating and encouraging others in the future. Thank you so much.
Thank you. I really appreciate you joining us for covering from the flu. I'm sure that cannot be easy. I know there was quite a few of us who've had whatever is going around the last few weeks. So thank you for toughing through it. And it was really wonderful to get to hear that your grandfather was able to be an organ donor and that for multiple organs. That's really astounding to hear and to know that his legacy lives on and your family, them, being very open to the concept and registering themselves to be donors is really inspiring. I think it does go to show the real legacy that's created with organ donation and how beautiful that domino effect can be in such a difficult time of life. And I think multiple of you have mentioned that power of connection and being able to be on campus and having tough conversations and meeting people. It's a really beautiful thing to see come from advocating for organ donation and for putting yourself out there as leaders. So thank you, Addie, for just reminding us all of the power of connection and being able to have such beautiful conversations with people and to reach your peers in a new place is really inspiring. So thank you. And next up, we have Hannah. Whenever you are ready to unmute and share your event with us.
Yeah, so hi, I'm Hannah Lang. I'm also recovering from the flu, but I am a BS MD student at Georgia State University studying neuroscience, and I worked with my local OPO LifeLink of Georgia to organize a event, a Lemonade and Learn event, which was hosted December 8th at Dalberg Hall, which is a really big building on campus. It's a really nice ballroom. And we ended up having a total of 50 different people come to the event and register to come to the event. And we had a couple different activities during the event. We had a group panel with GlobeMed, which is also a really strong organ donation advocacy and public health unity at Georgia State. And they were able to send their president and vice president to come speak as well at the event. We had a really interesting time. A lot of the people who attended were pre-existing donors and maybe had some more questions. I think that was mentioned earlier, and really just wanted to come out and ask some more questions. And also, we had new people come who were interested and open to the idea of donation and registering. And I believe 5 people did, but they did not go through the SodaLink program. They went through their own methods. But I think it was a really successful event in all. If you could see the top left corner was a group picture at the end of the event. And the bottom left was a local story we shared about LifeLink of Georgia and one of their most recent success stories that was in the news. So it was a really insightful event. I really appreciated the opportunity to have it and present it at Georgia State.
Thank you for including all these wonderful photos. It's really great to hear that you were able to partner so closely with LifeLink and also strategically to partner with another established medical group on campus to help maximize your reach. I'm really impressed with those leadership skills you've all shown and really understanding how to meet your peers where they are and how to engage with them. And it sounds like there were some really wonderful elements of reaching people who may already be registered as donors and just want to discuss that more, what it truly means, and also reaching new people and educating them from the ground up and inspiring them to register to be donors and hopefully go on to share that decision with their families. So thank you for putting together such a beautiful slide and for sharing with us. Up next, we have Emilio, whenever you are ready.
Hey guys, so I'm Emilio Stern. I'm from Mexico City, but I attend Wake Forest University. I received a kidney transplant about 3 years ago, and well, yeah, that's been great so far. It's working, it's pumping, it's good. Anyway, so I started a soda chapter here at my university. These are some friends that are part of the chapter. We took the picture yesterday. And, if you guys have also the chapter, you've gotten the wristband. So, I've been handing them out to my friends and to people in the chapter as well. Um, I've done a couple events where multiple people have attended, but I haven't really taken any pictures because it's more like since we're starting the chapter here and we're actually trying to make it so that it lasts even after we graduate, we're trying to just recruit members. But of course, all the members that I've recruited, that are probably over 40 or 50 people, and I've told them my story, and many of them have registered as donors as well. In March 22nd, I will have the opportunity to give a TED Talk representing the university, well, the students in the university, and I will be sharing my life story and talking about organ donation. So of course, that's great. It's going to be in the Wake Chapel, which is the main building here at Wake Forest University. So that's going to be fun. And then also with professors and what's it called? Yeah, with different professors, bioethicists, and economists, I'm trying to develop a way to find a legalized and regulated organ market. So we're trying to make a proposal and release a published what's it called? Yeah, research paper on it. Of course, there's many proposals, but Wake Forest has a great Institute for Regenerative Medicine and is known to be one of the leading transplant university hospitals in the country. So that's going to be great. Of course, I think through an organ market, you can save many, many lives. And if you make it ethical and through the government, the waiting list can be done like this, right? Of course, people want money, people need organs, and just doing it legally, it's good. And yeah, that's a bit about what I've been doing here at Wake since I got here. Yeah, and I think that sums up my advocacy events, and I'm really, really grateful for the opportunity to be a scholar for this scholarship and to partner with SOTA to do my events. And yeah, all of you guys sound awesome, and I'm really grateful to be part of this community. Thank you.
Thank you, Emilio. I really love that you've been partnering so closely with your university and really maximizing those resources that they have and the opportunities to really elevate your SOTA chapter and explore new avenues that you're really interested in. That's definitely what we aspire to see from our SOTA students is creativity and following your passion. So this is a really wonderful example of using your storytelling power, but also taking that to dive deeper into your research and public speaking and just really, really great resume building terms that can support you in your future career as well. So thank you so much for sharing with us. And up next, we have Megan. Whenever you're ready to unmute.
Hi, everyone. My name is Megan. I'm a second-year medical student at the University of Iowa, Carver College of Medicine. I've been involved with SOTA since my undergraduate education. I became really passionate about advocating for organ donation my freshman year of college when I started hearing the stories that organ donors, recipients, or donor families share, and just like the power and the hope that comes in organ donation and like that bit of light in a really dark time for people. So I started the chapter here at the Carver College of Medicine last spring, and then we hosted this event this fall. We had a Pizza and Perspectives event. So we had two wonderful members of the donor community come to speak at our college, and one is a living donor. That's Linda here, and she is a living kidney donor. And then one is a liver transplant recipient. And then we also had Morgan, who is our OPO community liaison. She works with Iowa Donor Network. And she was there to answer any questions on like the logistical side of things. So it was really great. They shared their stories and their experiences with our medical students and PA students. And it was just really powerful, I think, to see like from their perspectives in a demographic of individuals who are going to be future providers for patients undergoing transplants or for families who are considering organ donation for their loved ones. So it was a really, really great event to kind of gauge the knowledge gap and the questions that we have as future providers, and then also just to hear these really powerful stories from these donor community members. So we learned a lot on how we can kind of base future events, we have another panel upcoming this spring that'll be similar, but we're going to try to tie in like some more people that are maybe on the doctor side to add that perspective and the social work side to add that perspective. And then we're hoping to formally integrate this into the medical school curriculum in the future, which will be really awesome. So yeah, it was really great.
Thank you. I was actually going to ask if organ, eye, and tissue donation education is part of your medical school's curriculum currently, or is that something that is that gap in coverage like you mentioned?
It is currently, but currently it's very pathophysiology focused and very focused on like maybe the ethical side of things. We've had ethics discussions about it, but we really wanted to bring in like a patient panel and like a storytelling panel to hear really more of that, firsthand experience that donors and recipients and donor families like have. So that is what we're like looking to bring to the curriculum.
Right. Thank you. That's really important. We hear from medical students all the time that they feel there's some things missing from the donation education curriculums, which I always find slightly alarming to know that these are future medical professionals. And of course, it's really important that they be equipped with this education. And I think bringing in guest speakers from different backgrounds is so impactful to have recipients and donor family members and also Iowa Donor Network there to fill in with the educational piece. So a really well-rounded event, and hopefully your peers will remember it as they move on to their future careers, and you can get that curriculum more robust for your university. So thank you so much for sharing.
Thank you.
And with that, I know we have many chapter leaders on the call as we just heard from, but I did want to quickly just remind any students who may be interested in pursuing continuing with SODA. We do have a SODA advocacy event program as well as our SODA chapter program. The 3 steps for applying are here on the screen, and you can also visit sodanational.org/students. And if you're interested in chatting more, you can always reach out to me. I'm happy to help you brainstorm ways to get a SODA chapter going, or to follow up with a secondary event if you are interested. And I would just like to reflect on this award ceremony and say that I am so proud and impressed by the range of events that you all hosted. It's really incredible to see each of you taking your events in your own directions and incorporating so many elements that can just relate with your peers, and to see these leadership skills be exemplified through the advocacy that you brought to your campuses and the reflections that you were able to share with us is really, really inspiring. And I know we have our sponsors and some partners and OPOs on the call. I did want to give us a couple of minutes if there are any questions for our recipients or any comments or reflections that anyone would like to share. I would just, feel free to come off of mute or send something in the chat. Just a couple of minutes here if anyone has anything they'd like to say. Yes, I see a hand raised. Please feel free to unmute.
Good evening, everyone. I'm not sure if you're speaking of me.
Yes.
Okay. Good evening. I just wanted to say, well, first of all, I'm Trish Phillips, the Executive Director and founder of Multicultural Miracle Donor Foundation. That's a mouthful, so better known as MMDF. I had the honor and pleasure of being one of the judges for the HBCU scholarships, and it was a hard decision. And because of my foundation, it is dear to my heart. This was my 3rd time being asked to make the decision that you guys made so hard for me. What we do, I'm a living kidney donor. I'm coming up to my 10th year of when I donated my left kidney to my best friend. And I just wanted to let all 3 of you know that I really enjoyed your events. And I believe in what your presentation, and I just wanted to commend you because I know how hard it is to get the word out to multicultural communities. And kudos to you 3. And to everyone else that applied, congratulations to all of the other scholarship recipients. I think you guys are all amazing. And I'm looking forward to see where you guys go. Thank you. Have a good night, everybody.
Thank you, Trish, so much for sharing that feedback. It's so wonderful to have you on our selection committee, and I know it was a really rough year to have to choose just your top applicants out of everyone. So I think that really does go to show that these recipients are a really incredible group. So thank you for sharing that from your perspective as a committee member. And I would also just love to share that I appreciate all of you as well who are transplant recipients, donor family members. Of course, those of you interested in the medical career, I was actually wondering for our recipients who are interested, I know Megan is in medical school, but if you could raise your hand or send a little message in the chat if you're interested in pursuing a career in medicine. I always think it's super interesting to see how many students are going to take this education forward with them. And also something really special about SODA is that we not only reach people who have personal connections to donation, but also just the general public who find an interest in this field and who want to study it as a career. So I appreciate you all for your dedication and for your interest this year. And just a huge, huge thank you to you all for being here and sharing your events with us and making time out of your schedules to advocate for organ, eye, and tissue donation. And a huge thank you to Daniel Gibsback and Second Chance Fundraising for supporting these incredible advocacy events. And it's really great that we'll be able to continue on with so many of these recipients as they continue in their advocacy journeys. And to any of our students, again, if you're interested in continuing to work with SODA, if you don't already, please visit our website at sodanational.org/students. And for any of our HBCU students who might be interested in another paid opportunity to host advocacy events on campus, you can visit sodanational.org/join our team, where we have a mini marketing and event planning internship that's very similar to what you did on campus for your scholarships. So just another wonderful opportunity to stay involved. And thank you all so much for being here, to our OPO partners and our industry partners and our scholarship selection committees. This has been a really wonderful event and attendance. So thank you so much, and I hope you all have a great rest of your evening.
Yes, thank you.
Thank you so much. Have a good night.